Hi, I am Dr. Ryan Richard Bries, a gastroenterologist, and you are watching The Dose, your healthy serving of medical information from the Los Santos Medical Center. Hepatitis is inflammation of the liver. You see, it can be caused by a lot of things, medications, but the most common is viruses like hepatitis A, B, C, D, and E. When we talk about hepatitis, there are usually 5 main types. When you said about hepatitis A, it is usually foodborne, mean na cause pagkain ng mga food na infected with hepatitis. While hepatitis B naman is the most common hepatitis. Usually, it is by vertical transmission, blood transfusion, organ transplant, and mother to child. Next is hepatitis C, which usually is a transfusional hepatitis, usually via blood transfusion, sometimes sex, and sometimes sa IV drug users. Hepatitis D is usually seen in conjunction with hepatitis B. It is rarely seen alone yung hepatitis D. While hepatitis E is another foodborne infection, very common sa mga areas with low income. Hepatitis A and hepatitis E are both acquired by foodborne, meaning fecal-oral route, meaning pag nakakain ng food na infected, tsaka nagkakaroon ng hepatitis A and E. While hepatitis B and C naman is usually via blood transfusion or parenteral, meaning pag na-transfer from another person. While hepatitis D naman usually is a co-infection with hepatitis B. For hepatitis, the symptoms are almost the same, but they are usually non-specific. Usually, patients will range from asymptomatic, meaning walang nararamdaman, up to those with non-specific abdominal symptoms like abdominal pain. Some will have jaundice or naninilaw yung mata. Some will have fever. And some will have abdominal swelling or enlargement. Hepatitis is usually diagnosed via checking of blood. We have now blood tests like anti-Hab IgM and IgG, also for the complete hepatitis profile. Hepatitis A and hepatitis E are both treated supportively. There's usually no specific treatment for them. For hepatitis B, there are now antivirals present, like your tenofovir and your entecavir, which can help treat it. While for hepatitis C, we have those direct-acting viral agents like sofosbuvir and velpatasvir, and sofosbuvir and daclatasvir as well. We here in Los Santos have the complete lab test for hepatitis profile. We also for the liver function test. We also have here in Los Santos specialists ranging from gastroenterologists and hepatologists that can help us help the patient in diagnosis and treatment and management of hepatitis. The most important is to have it checked. Huwag po mahihiya kung may symptoms ng hepatitis. It's very common here in our country. Second is try to avoid alcohol, because alcohol usually synergistic with viral hepatitis. And also be careful with what you're eating and as well. Especially for mothers, do have your hepatitis B status B checked while pregnant so that it won't be passed to your child. For any concerns related to your gastroenterological health, you may contact the numbers flashed on your screen. Get your healthy dose of medical information and follow our social media platforms. Again, I am Dr. Ryan Richard Bries from the Department of Medicine, Section of Gastroenterology. Sa Los Santos Medical Center, we provide you global standards of care with a personal touch. Kalinga Ka Rito.